I am Dr. Sibel Demir. I'm a supervising physician who's responsible from non-surgical interventions and treatments of spinal disorders. I work with patients to treat their neck pain with or without arm pain, their low back pain with or without leg pain, and their mid-back pain. I work at UCSF Spine Center very closely with spine surgeons. And my team's goal is to help our patients to become as functional as possible. Bottom line is, when our patients are happy, we are happy. When our patients read their image findings, they feel like their neck, their back is falling apart. In reality, most of those changes are normal aging process. They are not causing pain or they are not causing symptoms. That's why 85% of our patients, they do get better with non-surgical treatments. I love working at UCSF because I love people being very open-minded here, and everybody is very collaborative. And clinicians and researchers, they work very closely, which helps us to provide the best care for our patients as well as provide the cutting-edge care for our patients. It is a very creative environment.